So in speaking about health anxiety, we know that everyone worries about their health sometimes. However, some people might develop a serious condition known as health anxiety, which is an obsessive and irrational worry about having a serious medical condition without substantial medical evidence to support it. People with health anxiety are more likely to experience physical symptoms rather than psychological, which leads them to often misinterpret these symptoms, and they are most likely misdiagnosed for a different disease. These people are constantly scanning themselves for new symptoms, and they often have worrying thoughts, which leads them to read and research more about these symptoms, which only magnifies their problem. This, in turn, leads to more frequent medical consultations and running unnecessary tests that significantly add to the cost and burden of medical care. As you can see, it's an ongoing cycle of trying to solve a problem that does not even exist. So, what can we do to break this cycle? This is where my research steps in. In order to solve this problem, we must first identify the scale of the problem and what are the trends and correlates associated with it. By using a standardized set of self-administered questionnaires, we asked the UAE community about the general symptoms of health anxiety. Our questionnaire included the Patient Health Questionnaire, the Illness Attitude Scale, and the WHO Wellbeing Index. This allowed us to identify the exact prevalence of health anxiety and as it has not been previously published by any article in the country. Next, we conducted a thorough analysis of the responses that we received, and we were able to identify the trends that are associated with health anxiety. First, we noticed that health anxiety is associated with a higher level of smoking and other poor social habits, such as disturbed sleep. Moreover, health anxiety was also associated with a higher educational level, because the more you know, the more you worry. This trend was also observed in people who scored a higher score in the WHO Wellbeing Index. So we concluded our study with a prevalence of 2.7% of health anxiety in the UAE community. This sheds light on the importance of managing health anxiety in the UAE. We aim that our study provides the basis for healthcare professionals to take appropriate action in reducing health anxiety. The affected persons must learn to identify the voice that their anxiety speaks in and to tell themselves that this is just me being overly anxious and it's not the end of the world. Thank you very much.